Hi, I'm Arnie Weiss, a pediatric dentist in Brookline area, just outside of Boston. I've been working with Hand in Hand for 15, 16 years now, and I'm a co-president with Dr. Berj Kalajian of the organization. I'm going to go through a little bit of the history and status of the Hand in Hand organization and dental health in Artsakh. So our evolving dental mission. Initially, we talked about providing basic dentistry and kind of makeshift facilities with a team of dentists, dental assistants, and hygienists 1 week at a time, part-time. And that has, so historically, IDA, the Armenian International Dental Association, who's the parent of Hand in Hand, was formed in 1995. It's an umbrella organization of a number of different organizations. Currently, it's run by the U.S. body almost exclusively for hand-in-hand clinics. Objectives of hand-in-hand: to do continuing education in Armenia, professional development in Armenia, continue education in the diaspora, clinics in Artsakh, mobile vans in Artsakh, and clinical assistant in Armenia and Artsakh. The general principles of Hand in Hand, how we run an organization, it's independent from any institution. Dental treatment and prevention is totally free. We have local input for hydro, water, phone from the local authorities. Collaboration only with the local authorities. It's an independent organization. And we have some financial partners for some special projects for capital costs, construction of equipment. Ongoing yearly, some staffing and supply costs, funded by donated supplies and cash contributions. So local authorities, the Prime Ministry and the Health Ministry, we have a good relationship with them. And the Prime Minister of Artsakh has always been very helpful for us. The health ministers over the years have also been interested in dental health and have backed us with our initiatives. The status of dental facilities in Armenia, it's very different than around the world. A very small number of state-of-the-art clinics, mainly in the capital city of Yerevan. And there's about maybe 40–50% are adequate clinics, but not up to date, mostly again in Yerevan and the larger cities. And probably half of our very poorly equipped dental clinics, mainly in the poor areas of Yerevan and many of the remote towns and villages. Post-war hand-in-hand Artsakh clinics. So we had clinics in a few areas right now. We have clinics in Mariget, Marduni, Karmishuga we just added, and we have one mobile van. We lost in the war Shushi, Lachin, Hadrut, and one of the mobile vans. Damage in that area because of the bombing and the drone bombing to the areas, the clinic, the mobile van. And the neighborhoods, luckily some of our clinics were not damaged as much as others, but some damage in neighborhoods are severe in many of those areas. Lachin Dental Clinic was built in '98, have 2 full dental units. The project was adopted by another organization in 1999, still working. It was lost in the war of 2020. Renovated Shushi Clinic was renovated not long ago. Again, it was lost in the war of 2020. It was our prime clinic. Brushadome from Shushi, the Shushi school system, we have a Brushadome. We'll talk about that a little bit more. That also was lost in 2020. And Hadrut, it was built in 2004, and it was lost in the war. We also lost one team member, Armin Melkumian, a really wonderful person, and we're at loss with him. The clinics that we have remaining in Mardiget, we have a 2-chair clinic in Mardiget, was established in 2006. It's an up-to-date facility. We have in 2019 it was renovated, and it has digital radiography, everything we want in a modern dental clinic. Great staff. Mardunia Dental Clinic, again, it's an up-to-date dental clinic. well staffed, well organized, all proper equipment there. Karmishuga, since we lost the Hadrut and Shushi clinics, there's a town, Karmishuga, which is about halfway between them, which is still in the Artsakh territory, and we took over a dental office in that area that has 2 chairs, and we're seeing the local people and some of the displaced people from their homes in that clinic. We have 1 remaining mobile clinic. It's stationed in Stepanakert, but it's treating the displaced persons there and people from the community, and it's in the process of now going out to some of the more remote villages to do dental care in those areas. And we're looking to replace that van, the van that we lost, so we can do more of that outreach. Mobile clinic, well run. It's a 1-chair clinic. It's well equipped again. That has a digital radiography, sterilization. It's a very nice clinic. It goes to the elementary schools, does screening, does treatment there, goes to some of the remote villages and schools, and does screening and teaching and treatment in those areas also. Continue education is one of our purposes there, to improve the quality of dental care and the quality of dentistry done there. We co-organized the first Armenian International Dental Conference in 1997. Partnered with ADA, helped recruit quality speakers and participants from the diaspora. We organized many continuing education and hands-on courses in Armenia and Artsakh over the last 20 years. Co-founded a Shine Study Club in Yerevan for young dentists. Committed to advancing advanced dental education to the practicing dentists in the smaller towns and villages, and whenever we have a program for our team, our staff, and our dental clinics, we invite the local dentists to come and to be educated. And just working with local organizations, the schools, the physicians, and local people, the governors of each province, to promote dental health. The first conference on preventive dentistry was done in 1997. First time they ever had anything like that in the country. 2000, 2018, we're just teaching in local level, getting dentists from local community to come in and presenting the more modern concepts of dentistry. 2019, we gave some presentations with co-op and some of the towns outside of Yerevan and some of the co-op centers. Again, we participate in dental conferences, sometimes the primary speakers in Yerevan. Artsakh, for sure, we're the primary dental educators. We lecture at the Yerevan State Dental University and in different regions, and just ongoing education to clinical staff. We do hands-on training, whether it's in endo or pedo. Here I was giving a demonstration, and we had the news people come in to watch how we're doing treatment using a rubber dam, doing treatment on young children, and it was well received by the media. Again, clinical demonstrations showing our staff, but also having local dentists come in and see how ideal treatment should be done. We're focusing on children. When we started, it wasn't that way. In the last 16 years since I've been there, again, I'm a pediatric dentist. We focus more on the children because that's the future of the country. If we can get their dental health ideal, we're not going to have the severe problems that many of the adults have. We have severe decay in the 3-year-old, 4-year-old, 6-year-old, teeth broken down, roots left. The decay, missing, filling is very, very high rate in Artsakh. Children with caries by age, 75% by age 5, 100% age 6, 97, 100. I mean, all kids had decay there. It's a sad thing. Sad thing to see how severe and how broken down their teeth are when basic sealants, basic preventive dentistry can help them. We are seeing more and more children under age 5. We're working on teaching the local dentist and the dentist in our clinic from specialists around the world how to treat the children, where it's in pediatric dentistry, in pedo endo, and the dentists are getting much more confident in treating these young children. So they're getting the tools to have successful treatment of pediatric dentistry. Working on preventive dental programs, it's kind of unheard of in the area. Introducing the concepts of proper hygiene, parental education, telling them that, listen, your teeth are like this, but you know what? Your children do not have to be like that. It's accepted by the population that, oh yeah, they're going to lose teeth, be missing teeth, and that's the way it is. We're trying to educate them. It doesn't have to be that way. Educating the parents, educating the children, talking about diet. We've been doing screenings in the school, and the screenings in the school are very valuable because we take that data collection, give it to health ministry, and they can see how severe the dental disease is, and helping us promote preventive dentistry and good oral health. We have a brush-a-dome. The brush-a-dome is we have a little further on, a room in the schools where the children come in and they'll brush their teeth daily, and they get oral hygiene instruction in the classroom and hands-on in the brush-a-dome. Again, just teaching them how to brush properly. And Brush-a-mania, we've had this a number of years. A Brush-a-mania is that we've gotten together with the principals in the schools in Arza, and we have all the schools together on a certain day, have an assembly, and there's a dental program there. We give them toothbrushes, everyone brushes there, and it just gives awareness to the preventive dentistry. 10,000 children we're seeing from us in the Ministry of Education, Ministry of Health, everyone work together and have media to cover to promote the dental health. The schools have dental assemblies. The students and the teachers put together performances about preventive dentistry. The local government officials and the press are invited, and it's just something that's very worthwhile in expanding the preventive services in the country. Here's some school kids, and they're getting together, some with the teachers. The one on the upper right is one of our dentists, and working together, giving presentations about dentistry. This is a brush-a-dome. Kids line up, they come in here, and there are 5, 6 sinks. They go ahead and they'll go ahead and disclose, they'll brush, and people help them and advise them as far as to do it properly. Again, the brush-a-dome, it's a very nice thing. It started in Brazil, and one of our board members had started it in Brazil and brought it to, and this is the first one. We're building another one in Marduni, but this one in Shushi is the one that we lost during the war. A great team at all the different offices, some of the volunteers from the U.S., the dentist assistants and office staff from the dental clinics that we have currently. We go in, and in Shushi, Marduni, Hardut, we've done dental screenings there, and again, have some great statistics. We'll go into the classrooms, we'll do examinations, do charting, and document dental disease. In 2014, Dr. Kalajian was awarded a presidential award in Arza, and they're recognizing the value that we're giving to the country and to the children. Some statistics. Total number of patients, we've seen 163,000 plus patients. The caries prevalence, as I said before, 70% of primary teeth, 72% of permanent teeth, and the combination 95.6% kids have decay. Total cost of treatment paid by the government at the low rates that the government decides to pay, not us, we're a completely free clinic, is 568 million Armenian dollars. And it's, across the board, not just extractions, prevention, restorative, endo, etc. Expenses, salaries about 65%, the dental supplies 17%, equipment and administrative office supplies. Annual budget is approximately $150,000, which for having 3 clinics and 2 mobile vans that we had before, the dollars that you put into it are just multiplied. It's amazing what you can get for the dollar as far as treatment in the country. We've introduced certain technologies. We have digital x-rays. We have a panoramic unit in one of the units. Luckily, it's in one of the units that we still have. Intraoral camera. We developed a dental software that is very similar to dental software used in the US and other sophisticated countries. And we have electronic records. We're not using paper charts. State-of-the-art infection control. We're using silver diamine fluoride to prevent, to arrest decay on the young children. And we have Zoom case presentations. We Zoom with the staff and we go ahead and go over cases, and they present cases to us in consults. Again, the digital radiography, excellent. We have dental software to do charting and put treatment and do notes. Again, a panoramic, which is great for growth and development. And again, the Zoom sessions we'll do every 6 weeks, give or take, and each of the dentists is supposed to pick 1 or 2 cases. They present the cases from radiographs, charting, treatment plan, what was done, and they also get feedback from us on what we would have done differently, and also they bring up cases that, gee, here's a case, what should we do with that case? So educational, and it's improving the quality of care that they do for their patients. We have orthodontics, and it's not full orthodontic care, evaluations, space maintenance, monitoring tooth movement, and just kind of let the parents know that this is a time that something can be done to prevent severe orthodontic issues. So we've reduced emergency cases. It used to be mostly emergency, even 16 years ago when I first started. Now it's not like that anymore. Less pain and suffering for the children and adults. We've saved many more teeth, which would have resulted in orthodontic and prosthetic treatments, increased oral hygiene awareness, and treated more and more younger children. We've introduced silver diamine fluoride. It wasn't approved in the US until 2016, and 2 years ago we introduced it into ARTSA, and they're able to see these young children that have severe caries and maybe are pre-cooperative and arrest the decay, apply it once, a second time, and by the time the child gets used to coming to clinic, the teeth can be restored normally. Doing pit and fissure sealants, we've seen kids that come in, first permanent molars broken down to the gingiva, need to be removed because they're not restorable. From occlusal caries, this would be prevented by sealants. It's not done a lot. We're doing it now in our dental clinics and promoting it that it should be done around the country. And educating the country, even the dental school and the local dentist, to do sealants on the young children. We've had past supporters, and have to acknowledge the past supporters of Hand in Hand. The Canadian organization, Armenian Fund France, a new foundation, government of ARTSA, who has been very, very helpful, very supportive, the Health Ministry of ARTSA, and Friends of Hand in Hand. Everyone has been very helpful in enabling us to do our mission. Here's a beautiful view of Mount Ararat overlooking the city of Yerevan. One of our major goals is to develop a national dental plan for Armenia and ARTSA. We've been working with the government on establishing this plan, and it would be a great achievement for us to get the dental plan in preventive and restorative dentistry in the country for the children. Our current goals are basically to continue servicing the refugees who fled their homes, who fled to Armenia from ARTSA. They left everything behind. It's just unbelievable. They should leave their home, their possessions, and they have nothing. And now they're in Yerevan. Hopefully they'll be able to come back to their homeland. Brushomania, continue Brushomania programs each year to give nationwide assembly and dental health education. Raising funds to replace the second mobile clinic to serve more rural villages. Established brushodomes, we have one now, but we'd like to have 2 or 3 more in the school system in ARTSA to keep the education level high of preventive dentistry. Replace some equipment and supplies lost in the war of 2020, and continuing to improve the quality of care for children in Armenia. I want to thank you very much for the opportunity to present the history and the challenges that we have in hand. And if you have any questions, please, you have my email, Dr. Kalashin's email here, and the website of Hand in Hand is here to go look and to see the status and see what we're in the process of doing. Thank you so much for your help. God bless.